Global environmental conservationist every Wednesday, 8 to 9 p.m. here on WeFM 99.9. Your health matters. Ask Dr. Thompson any burning question you have related to health. Your health matters. Dr. Thompson will examine healthcare, highlight important environmental issues, and look at what's hot in science and technology and the next wave of emerging diseases and health trends. So this and every Wednesday, join us 8 to 9 p.m. here in BFM 99.9 because your health matters.
People's Pharmacy for all your pharmaceutical, skin, and body care needs. Located on Grenville Street in Kingstown. They open 8 a.m. to 8 p.m. Monday to Saturday. Call them today at 784-456-1170. People's Pharmacy also stock vitamins and supplements, personal care items, toiletries, children and adult pampers, and much, much more. And of course, get your prescriptions filled by a friendly and professional pharmacist. People's Pharmacy. Come in today and let us serve you.
Good evening. This is Your Health Matters. And it's always a pleasure. Always a pleasure being here on a Wednesday evening, Wednesday night, 8 p.m. And it's a matter of bringing out certain issues. Sometimes we're a little controversial. Sometimes we're on the cutting edge. Sometimes it's the main concerns that we might well have about our lives, about our health, and so forth. We talk about a variety of things. Over the weekend, I participated in a small health fair in Chateau Belair. A health fair in Chateau Belair. And went down there on Saturday and, oh gosh, I think I would have seen close to about 50 patients. Some nice persons of varied health. And it was reassuring, giving them advice on what to do next, how to improve their health, checking them out and putting a smile on their face, getting them confident. Those who needed some additional care, making sure they got that too. And this week, it's a lot more things that are taking place, a lot of things that have been happening in the country. And there's a big upcoming event, and it's called Cannabis SVG. Many of you would know I'm the CEO of the Medicinal Cannabis Authority here in St. Mr. Grandies. And this evening, rather than doing it a little later in the month, I want to do and talk a little about it now, tonight. This event, Cannabis SVG, is going to be a medicinal cannabis festival. It's more celebrating the achievement that St. Vincent Grandies has reached thus far. It doesn't mean that we don't have much further to go, a long way to go, but this is where we've reached so far. And it's worth celebrating. And this event is going to take place Friday, November the 1st, Saturday, November the 2nd, and Sunday, November the 3rd. It is going to be at Arnersville Sports Complex, at the stadium. And don't worry, it's not going to be inside the field where they're going to be playing football or cricket or anything. No, it's going to be utilizing the amazing facilities there. The President's Suite. We'll actually be using one of the grandstand, Mike Finley stand, for one of our big lectures, for some of our big lectures. And in addition, in the area behind Arnersville playing field, looking down at Beckway, just near to the double-decker, we are going to be having a major event underneath the double-decker. It's a massive space underneath the double-decker. For anyone who's ever been to the double-decker stand, there's a massive space under there, and we are going to be holding a major exhibition of many things. Exhibition of not just cannabis, but also food products, what people are producing. There's going to be exhibition of plants, exhibition of craft, exhibition of of different type of food products, the pepper sauces and the juices and all these sort of things that are being produced here in St. Vincent and the Grenadines that's making our life that much richer. All those things are going to be displayed. I'm going to surprise you the amount of craft and other things that are going to be there. And then they are building and recreating a traditional cultivators village. This is going to be teamed up with the folks who organize the ITEL Festival. And so there's going to be foods, there's going to be all sorts of things. And people are going to be displaying their medicinal plants, they'll be displaying cannabis plants, they'll be displaying their food products. But that village is going to be made out of bamboo setting. And it's going to be a major, there can be drummers there, there'll be artists there, there'll be steel band, there'll be all kind of cultural activities. All of this just behind Arnesville playing field where the media stand is. And so, and I say not inside the park where the grass there, but behind it. And there's going to be a designated smoking area that's being controlled under the laws of St. Vincent and the Grenadines. And that's going to be very nice. There'll be lots of exhibitors in the expo. And additionally, on the Sunday evening, there's going to be a major cultural event, a big show, where I understand that Marlon Asher, is going to be there. I'm a ganja farmer. There's going to be Bushman. He's going to be there. There's Sasha, she's going to be there. And Christopher Martin is also going to be there. So this is going to be, apparently tickets have been sold all over the place, where the 4 Shells out in Calaca. I don't have a list of all the names and so I should try. I should have had those names. But guess what? I'll have those names before the end of the show, right? And what else is that there'll be lots of local artists, Boozer and other individuals. They'll be there too. We're leaving them out and so forth of the event. And it's going to be a great show that Sunday evening. The show was going to be first of all on a Saturday, but it's going to be on a Sunday instead, and for lots of reasons. But it's going to be in a big space behind the actual stadium as well. The stages are going to be set up. It's going to be a wonderful event. During that time, there are going to be tours to various farms of the country. These tours should go very well, and what we are mainly going to be doing is that we are going to be having a whole series of lectures and public education, right? Now, public education for those people visiting the show will take place in certain locations. But people are going to be coming in from Trinidad, Grenada, from Barbados, from St. Lucia, from Antigua, from Jamaica, people coming in from Europe, from London, people coming in from Canada, from the United States, and from across the region to attend and participate in a whole learning process on cannabis and medicinal plants. We have some feature speakers from New York, a Dr. Junel Shin, an expert. We have a Dr. Makel Emmanuel, who is a botanist from Jamaica, and he is going to be there. He's actually married to a Vincentian. Actually, there's a Dr. Hans Clark, who's a Vincentian doctor in Canada, who is one of the leading pain specialists, and so in the United States, and he'll have other members of the team. We're going to have persons from Florida, from Washington, and from Holland, the Netherlands, and of course, we'll have persons from Jamaica and other Caribbean islands. Dr. Belle Antoine, who's the principal of St. Augustine University in Trinidad, she's going to be there. She is a lawyer who headed the law faculty there in Jamaica. So it's going to be a power-packed thing. So on one hand, we are going to be inviting doctors, pharmacists, nurses from across the region, including St. Vincent Grenadines, to come and attend various lectures. There's also going to be traditional cultivators. I know Spirit and the Nyabingi and all these individuals, they're going to be there. You know, farmers, traditional farmers from all over the country are going to be there. And they are going to be participating in lectures. Now, their interests will also be on the legal justice reform, decriminalization, all those sort of subjects. Their interest is also going to be, how do you grow quality products? How is it grown in a quality manner? And not just cannabis, but also other plants. And this is going to be a big, and people will be able to choose which lectures they're able to attend. There'll be lots of cultural activities, as I said, but the main feature is educating people on a number of the new innovations coming out. Now, at the same time, the general public, we're going to have some sections that actually can teach the general public about medicinal plants. You've heard of seed on the leaf. What is it really? You've heard of body may I. You've heard of part of man life. Well, I don't know if you've heard of Congo Lala, and you've heard of DKPI, or you've heard of many of these other type of plants that may have medicinal properties. There are plants that were used by the Caribs. There were plants that were brought here by African slaves and indentured servants. There were plants brought here by Indians when they came here as indentured servants, and plants brought by Europeans. It's amazing. We know breadfruit was brought in here. Breadfruit in itself has a whole set of various properties. Mangoes was brought in from India. They have a lot of properties. So people will be able to learn about it. And we're going to be having this system of Ministry of Health. People will be able to come get their blood pressure checked. They will get their blood sugar checked out too. It's a whole set of things there. People from Ministry of Agriculture, you could learn about soils. You could learn about pesticides, application, all them kind of things. All this information is going to be available at this cannabis festival. So this cannabis is not just about cannabis, it's about food. It's about also other medicinal plants. It's about culture. It's about a host of different things. Now, I'm really excited by it. I know some people will be more excited by Bushman, Steve Christopher Martin. I wonder what is it. I wish I could sing like Chris Martin, right? You know what I mean? And Kamal, I would mention something like Bushman would be there. I say, yeah, good, yeah. I say Marlon Ash would be there. Oh yeah, that's good. I say Chris Martin be there. Chris Martin be there. People get really excited by it. Why? I'm asking you, why is that? I'm sure he's considered as a major artist, is he? He is, eh? Yes.
Yeah, he's a big reggae artist. He's a big artist in the reggae industry.
Yes, yeah.
So he's loved by many.
He's loved by many.
He's loved by many. His songs. He has very good songs.
His songs also veer on the direction of being more clean and so forth. Yeah.
For those that I know.
He has one Cheetah's Prayer and so forth. Is that considered clean?
Well, I would say yes.
You think so?
Yeah. I mean, it's been played on the radio. I mean,
yeah, I only kidding you. I only fooling you.
Just don't get caught.
I wanted to seize the opportunity to talk a little bit about the science of cannabis and to go back, and I want to touch on a couple of things. Right? I want to go into a little bit of background, and I want to look at the science, the benefits, and then the evidence, the real evidence. But if I go into background, I want to say something. I wonder if those persons listening realize that aspirin, we've all heard of aspirin. This was a drug that was only invented in 1897. 1897. In other words, it's only 120 years old. Imagine that. Aspirin is only 120 years old. Chatelier used to be here in St. Vincent in the 1700, late 1700. That would have been 200 years before, 100 years before the discovery of aspirin. Yes, sir? That's 220 years ago, roughly. The point I'm making is that the Romans, the Greeks, the Persians, these empires, all these empires around that time, and I mentioned the Caribs, the Garifuna, under Château would not have known about aspirin. Now, strangely enough, everyone's heard of ibuprofen, right? Everyone's heard of ibuprofen. One of the brand name is Advil. You could go into the store and buy a couple of Advil tablets, easy in a little packet, right? Or some ibuprofen. Kamal, you've heard of ibuprofen, of course, right? Do you know ibuprofen was only discovered in 1961? 1961, and only went into use in England in 1969. In other words, it only became available on the market in 1969. And in the United States and around the Caribbean, it only became available in 1974. Now, I don't know how old you are, Kamal, right? But 1974, 1975, you know, I have a feeling that you might have been born sometime around that time, but ibuprofen has only been around roughly 50 years. You know what I mean? 50 years. Ibuprofen has only been around 50 years. Normally, when people are having cramps, muscle aches, and those sort of things, you take an ibuprofen tablet to ease it. Maybe you might take a Tylenol, a Panadol, or something so. But we think the ibuprofen is a little stronger, you know? Matter of fact, we think ibuprofen is stronger than aspirin, right? Yeah? Yes, it's a little stronger than aspirin.
Use the word think. We think.
Yes, yeah. Well, I'm gonna get into.
Oh, okay, all right.
You know, but ibuprofen is mainly for inflammation. Panadol, something called acetaminophen, which is Panadol, right? Is mainly just for pain, not inflammation pain. It's for pain. You get pung, you stump a toe, somebody, you know, punch you, and it hurts, you get some Tylenol. But if you have inflammation, arthritis, pain, and a swollen leg, and it's, oh gosh, it's inflamed, then going with ibuprofen may be a better, because it's also, it's a kind of an anti-inflammatory painkiller. So it works in that way. But what does that mean? If ibuprofen is better than aspirin, what about 1950s? What about your grandparents who lived in the 1940s and 50s? What about your great-grandparents who lived about 1910, 1920? Yeah, they might have had aspirin, but they had no ibuprofen. So when they had real pain, when a woman had period pain, you know, or when you got struck by a cricket ball in your side, you know, or somebody hit you with a 2x4 with a stick. Therefore, how do you get rid of that pain? Well, I suppose you could have gone with aspirin, you know, but you didn't. Our grandparents, our parents, and so may not have had ibuprofen available, because it only went onto the market in America and the Caribbean in 1969. 1969, that's 50 years ago, you know? I'm older than 50, you know what I mean? So if I was in St. Vincent prior to that, I would not have had ibuprofen if I got struck by a cricket ball. You know what I mean? I had to go with something else. Well, the other thing I want to say is that there's some type of pain. You know, I wonder if people realize pain is one of the most profound negative feelings you can have. Having a headache, like a migraine headache, or somebody who is having pain during or after childbirth, or imagine surgery and somebody has cut something out, cut your foot, cut your hand, and you don't have the pain medications to numb the pain. Imagine you have a toothache. Everyone have a toothache and you don't have anything to dull that toothache. You want to take that tooth out, you tie a string to your tooth, tie it to a door and slam the door to try and pull it out because there's no there's no tooth extractor man about the place. Have you ever been in that kind of situation? No, in these modern times, we don't have that. Long ago, in the 1960s, 1950s, 1940s, I am sure that was the case. Or when somebody has, let's say, a cancer, and the cancer start to spread to the bone, or like you have an infection that is spread to the bone, and it's causing real pain. And with those kind of pains, aspirin and ibuprofen won't work. Yeah, ibuprofen is a little stronger than aspirin, but ibuprofen ain't gonna work when you have cancer going into a bone. Somebody had breast cancer, prostate cancer. Prostate cancer loves to travel to the bone, the backbone, the bones in your back, in your spine. And imagine having pain and there's no relief. Yeah, you could throw some hot water in it, and true, you could try and sap it, and true, you could try and anoint it, and some people are good anointers, but every now and again, when they try to anoint it, it might make the pain worse because they touch a wrong spot. You know what I mean? Boy, there are some drugs that people used to use long ago too, and I want to tell you about them. You've heard of opium? Well, opium is from a plant called a poppy plant. And in the poppy plant, there's some seeds. And here's what they found. They found that in these seeds was different type of chemicals. One of them was called morphine, and one was called codeine. Now, some of you have heard of codeine before, I'm sure. You know, sometimes we combine pain tablets with codeine to make them a little stronger. So when you want extra strength pain tablets, you combine codeine with aspirin, or combine codeine with ibuprofen to give it an extra boost, or with Tylenol or acetaminophen to give it that extra oomph. And boy, sometimes those things could kill that pain. The pain of a cancer trying to dig into your bone, the pain of an infection that's difficult to treat, reaching your bone, especially if you have a sore foot and the infection has bored a hole in your foot and reached the bone and it's infecting the bone. Let me tell you, I can't tell you how imagine that, how painful that is. For that, those kind of pain, aspirin and ibuprofen don't work. Combined with codeine, maybe they work. But they used to use sometimes morphine, and so the early days, morphine was used. Now, I don't want to give you any information, but some people took this morphine and they heated it. And as a result, they were able to make heroin. And boy, people started abusing the heroin. And they would inject it into their veins, inject it into their muscle. And the funny thing is that with the improper use of heroin, you can cause what's called an overdose. You know? Now, reason why is overdose. You can have heroin that is not so pure. We call it black heroin. I don't know why they do that. Black heroin. Or you can have heroin that's a little purer. They call it brown heroin. Or you could have pure heroin called white heroin. It sounds a little racist using those terms. But if you're in the habit of using black and brown heroin, that's not so pure, and then you get a batch of pure white Asian heroin and you take it, and you make the mistake and take the same amount as you used to take for the brown and the black heroin, guess what? It works so good that it could give you an overdose. Let me tell you that millions of people have died from heroin overdose across the world. Now, funnily enough, in the 90s, we call 90s the age of biotechnology. Biotechnology. And they started a new process of, instead of using heroin and morphine and opium, they came up with some synthetic painkillers. One of them called fentanyl. Gerald Thompson, as a doctor practicing in the United States, had patients who had infections in their bones. And they would come into my office bawling that the pain medication they were getting was not enough. And then drug reps and various companies came and said, guess what? We now have a new drug called fentanyl. And guess what? Boy, it can kill pain. And guess what? It's not addictive. Not addictive at all. And I remember for my patients with infections in their bone, with cancer going through their bones, writing a lot of fentanyl for these patients. They did well. It helped with the pain, no doubt. It helped with the pain. And let me say about fentanyl.
Before you go to fentanyl, somebody says that one becomes addicted to codeine if taken too often.
You know, codeine, yes. You can become addicted to codeine, but you will far more become addicted to morphine. You will far more become addicted to heroin. And I was just going on to say, you become even more addicted to fentanyl and some of the other synthetic medication, one of them called Vicodin, or one called Percocet, or one called Petidine. We have Petidine here in St. Vincent that we give out, Petidine. And guess what? Just a small amount of Petidine. You use Petidine for more than 3 doses, you have a high risk of addiction too. Now listen to this very carefully. Fentanyl, right, is 50 times more powerful than heroin and is 100 times more potent than morphine. You hear that? Fentanyl is 100 times more potent than morphine. And fentanyl, I believe, was one of those drugs that killed Prince. He apparently didn't know he was really taking fentanyl. Prince, the star, was on fentanyl. A lot of people have been on fentanyl, such to the extent that last year, or year before I should say, fentanyl killed 106,000 people in the United States alone. In other words, fentanyl was able to kill the population of St. Vincent and the Grenadines in the United States, equivalent to the population of St. Vincent and Grenadines. Fentanyl, a drug that's a serious painkiller. It kills the pain, but it creates such a level of addiction that it's unbelievable. Now, I want to tell you a little bit about pain, though. And as well, me understand pain. If I were to take a stone and throw it at your arm or throw it at your leg and throw it hard where it injures your muscle tissue of your thigh, your leg, you will feel pain straight away. Pain is important. Pain tells you that there is an injury. Pain tells you, boy, you don't want to feel that again. Move away. Run. But if you can't run, it tells you that it's a serious injury you have to the muscle. So by injury to the muscle, or if you bite your tongue, you feel pain. If you stomp your toe and you jar your toe on a steps, you will feel pain. That is because you are injuring muscle. You're injuring tissue, whether your tongue or what. That is a certain type of pain. There's another type of pain. Suppose the nerve that's going to a particular part of your body gets cut or gets inflamed or damaged. Nerve damage. Neuropathic pain, as we call it. That's another kind of pain, boy, because the nerve don't like being damaged. You know? If you damage a nerve, that nerve goes crazy, starts just bawling out. It's screaming. Your nerves start to scream, whichever part of your body. Scream, and continue to scream. It might calm down after a while. But injury to nerves is different from injury to tissue. It's damage to the nerve. Now, there's another type of pain called phantom pain, if I call it. The real name for it is nociplastic pain. I don't want to use them fancy. Come on, I shouldn't use them fancy words, right? Let's call it phantom pain. Phantom pain. There's no injury. There's no nerve damage. It's because the wiring, whether inside your brain or inside your spine or inside your nervous system, the wiring is funny. What would happen if I were to put on a light switch and instead of the lights coming on, the fridge turns off? What if I were to turn on my television, but instead I click the thing for television, what happened in my car alarm start to go off? That is supposed to happen. Something is wrong with the wiring. Something wrong with the wiring somewhere. And there's no injury. There's no evidence of injury. Nobody hit you. Nobody pung you. You wasn't in an accident. And there's no nerve damage. There's no cut, no knife cut, no stabbing, nothing like that. No injury. It's that the wiring just started going wrong. As if rats got into your car and start to eat up some of them wires and so forth. And now your lights can't go on, your indicator can't go on. You know what I mean? Something funny like that. And you don't know. This is phantom pain, nociplastic pain. And I'll tell you, doctors used to think that when a patient come to them and say, Doc, I got this pain. It's the worst pain I've ever had. And the doctor examined the patient and he ain't find no evidence of injury. The doctor go and do some tests to check the nerves out. No evidence of nerve damage. The doctor started to say, I think this patient is trying one on me. I think this patient is fake. I think this patient is trying to fool me. I think this patient may be trying to get some fentanyl, some heroin, some Tylenol number 3, Tylenol with codeine, you know? And that's what they want me. But guess what? I go show that patient, I ain't giving him nothing because I ain't find no injury. I ain't find no pain. Matter of fact, guess what? I'm going to tell the patient to go out some aspirin. And the patient knows, has tried aspirin before. So you know, the patient leaves dissatisfied, maybe to go to another doctor who might tell them the same thing. In the 90s, 80s, we used to think that a lot of patients, they were what they call psychosomatic. That is because of their relationship with their husbands or their relationship with their wives, why they're having pain. And therefore, they should fix the relationship with their husband rather than being placed on medication. But then, when the fentanyl came by, he started prescribing a ton of fentanyl. Hey, okay, take that. And guess what? The patient come back and say, thank you, my pain is gone. You understand? But a few years later, these patients were all, contrary to what the drug reps had been saying, that it was not addictive, it was super addictive. It was highly addictive, really addictive. And that's a problem. Now, let me say something else. You know, 1 in 5 people may be living with pain. And every year, 1 in 10 of us develop a new type of these phantom pains. These nociceplastic pains are now coming. Do you know anybody with this kind of pain? Who in pain on and off constantly? These kind of pains are pains like migraines. They're bowel pains, inflammatory bowel disorders. They're people who have their bladder. They can't hold their bladder, pain in their bladder. You know, all sorts of different reasons. Fibromyalgia, one of them. I'm giving you some technical terms. I didn't want to do that. But the important thing is that pain for these people is real. And we were ignoring it. Doctors ignored it until we got some education and realized there's this third type of pain that really affects a lot of people. Phantom pain. No injury, no nerve damage, they just got pain and they could be treated. Funnily enough, you know, one medication has been shown to be quite effective for these phantom pains. It's cannabis. And at least if these patients who were taking some very strong pain, the petadine and the synthetic opioids and all this kind of thing, that by taking cannabis, they could reduce the amount of these highly addictive medications, reduce them down. There's some athletes in America, footballers. Do you see some blows that people just get? Somebody in a scrum and they're going after them and they tuck their head down and they're hitting their chest with a helmet or hitting their leg. You could imagine the amount of injuries people get. These people suffer a tremendous amount of pain because the jarring of their body, the impact on their spine and all that kind of thing. Matter of fact, some of them get knocked out. They have concussions and their brain gets shaken up. Their brain gets shaken up, you know? their brain gets shaken up. Just like this getting shaken up, their brain gets really shaken up and injured, and that's a whole new subject. You know, additionally, besides pain, do you know the amount of people who are suffering from anxiety? And strangely enough, and I don't want to say this, they say there are far more females who suffer from anxiety disorders than males. And anxiety could develop for all sorts of reasons, but people get anxious. A hurricane is coming. How do you behave to that? Do you start to sweat? Just the thought of it, does it make your heart start to beat fast? Does it make you start to breathe? Or if somebody asks you to get up and sing a karaoke song, what happens? Do you start to feel lightheaded if you want to faint? What if, you're called out to say something and you start to open your mouth and nothing comes out your mouth? You can't speak, and you're watching around, you think people are going to laugh at you, and so you got to run out of the place. Anxiety is a real funny thing. A lot of people suffer from various levels of anxiety. And then there is severe, really severe anxiety, something called PTSD, post-traumatic stress disorder. If somebody has been raped, and the person who raped them, they still see them. Or if they see somebody who looks like them, it's not them, what reaction does that create? Seeing somebody, you know it ain't a person, but you wonder, it brings back memories. What if you lose a leg, your leg get cut off? What if an arm get cut off? What if a breast get cut off? There are a lot of people who suffer post-traumatic stress disorder. What if you got shot by a bullet? Or if you had a road traffic accident and went off a cliff, but you still survived, you had a bike and you went off the bike. Or so, a lot of these things can cause post-traumatic stress disorders for a lot of reasons. Somebody who is raped, they often suffer. Could you imagine living in a conflict zone? Imagine living in Palestine. Imagine living in Lebanon and a bomb go off near you or somewhere, all these sort of things. You could be very anxious. And anxiety is such a difficult disorder because most people keep it to themselves. Because inside them, you know what they're thinking, and they're thinking, I'm scared of Kamal. Kamal's watching me. I wonder if he's going to hurt me. I wonder if he's going to do something to me, And Kamal's smiling. I wonder why he's smiling. He's coming now. He's going to attack me now. I know it. Huh? Yes. A panic attack is a form of anxiety. But most people, it's a slow process. And their brain is thinking. So they don't get, Their heart is beating fast. They're breathing, they're anxious, and they're trying to calm it down, but they can't. But they know that they're suffering from anxiety. One of the treatments for anxiety is Valium. Another treatment is Xanax. The amount of people in this world who are taking Valium and Xanax, and let me see. I was telling you about fentanyl causing deaths in North America. In Europe, in Scotland is the country with the highest amount of overdoses as a result of Valium and Xanax. A lot of our elderly persons at it. Do you know what is potentially a safer drug for anxiety? It's cannabis. It's CBD. I'm not even talking about THC, the one that might get you high. I'm talking about CBD, the one that doesn't get you high. It's not bad for anxiety, And can really help control those particular type of things. The reason why I'm saying all this, I wonder if you know that inside your body that there's a system you may not have heard about called the endocannabinoid system. Kamal, you heard me talk about this before? Yeah? Yes. The call. Hello?
Yeah. Hello.
Hey.
Yeah. Dr. Thompson.
Yes.
What do you call it? That you came after the morphine and everything that you said came. The last one that came out. Something in the other.
Fentanyl. Yes.
Hello. What's that?
Fentanyl.
Fentanyl.
Fentanyl. Fentanyl.
The thing is that you could still get that in the hospitals to buy.
Well, listen to this very carefully. I know you know.
Wait, I'm not hearing anything at all.
You're not hearing me. Let me talk a bit louder.
Yes, I could hear you now.
Okay, sorry, I was talking softly. I was talking softly for drama. You understand? Now, imagine, and allow me to say this, there's a special category of drugs that they say have no medical use whatsoever. It wasn't until 2020 that they said that we now realize cannabis has medical use. And instead, fentanyl, which has been killing all these people, was not in that category, right?
I see.
Because it has uses to kill pain. And yes, fentanyl is still available, but you have to have a special prescription for it. But they have been
I've been curious about something for the longest while, Dr. Thompson.
Yeah.
We all grew on Fensic. And one morning we got up and heard that Fensic was not good and it came totally off the market.
Yeah.
Up to now, since then, Fensic has never been brought back into St. Vincent and sold in the supermarket.
Yes.
You remember Fensic?
Yeah.
I don't know. They took it up like it was poison.
Now, Fensic is really aspirin. Did you know that?
What's that?
Fensic is aspirin.
Oh.
Right? Now, you know, it's amazing how we do. Now, in addition to aspirin, though, there are a couple of other things. They add a bit of caffeine to it. You know, caffeine in your coffee. They add a bit of that.
Well, they'll take aspirin off the market again just now then.
Huh?
If it's getting dangerous.
No.
We'll have to go to our local, what you call it, from our marijuana plant.
No. Now, there was another drug.
I can listen to you off
Okay,
here.
sure, yes.
Okay.
Yeah. There was also another drug in Fensic called what's the name? It's called phenacetin. So Fensic was aspirin, phenacetin, and caffeine. Aspirin, or let me say phenacetin, aspirin, and caffeine. Pack. Phenacetin, P, aspirin, A, and caffeine. Pack. And yes, this was not really a narcotic, and so is a thing, but I'll have to double check why it might have been taken off of the market if it did. You know, we know that phenacetin eventually was considered to have some cancer-forming properties. So, last caller, the aspirin in Fensic was okay. The caffeine in Fensic was okay. But the phenacetin combined with these other medications was a good pain medication. Not as good as ibuprofen. Not as good as ibuprofen. But hear what? They found that the phenacetin part of the Fensic had some cancer kind of thing. They wasn't sure it was safe. So ibuprofen and them other kind of medication just come and knock the Fensic off the market. So the drug companies say, boy, they say it could cause cancer. It could have something. And look, we have ibuprofen over. Let's go for ibuprofen instead. Let's push that instead. You understand that? That's the way things go sometimes, caller. It isn't necessarily that the phenacetin actually causes cancer, but they can't rule it out that it contributes and that it go. And to prove it, if I were to give you a whole set of phenacetin and follow you for 10 years to see if it causes cancer, and then it causes cancer, what kind of study is that? Eh? How much I have to pay you if it causes cancer, brain cancer, all that kind of thing? How much I will pay you? How much millions? How much, you know what I mean? And you alone? Is it that I got to do that to a whole set of other people? No, those studies are very difficult. But once there's a suspicion that something can help to induce cancer, it usually is taken off of the market because of the liability, the risk involved. The manufacturers can't take a chance. So what they do? They close down the shop and go for a different drug. Put their money on a different drug rather than continue with one that they might start to run into problems. They don't want to hear, okay, if 2 people develop cancer, they might say fine. But if 2,000 people develop cancer, somebody going to jail, some people going bankrupt, you know what I mean? That sort of thing. Now, I'm glad that question came in though, you know, because I am making the case that pain, anxiety, and a number of other disorders are so common. Does everybody know that sleep disorder, insomnia, is so, it affects about 20% of the population? The host of the people that have problems sleeping, you know, Kamal, do you normally get a good night's sleep and so forth? Oh, Kamal gets a good night's sleep. But I'm sure persons out there have difficult, you know, and the amount of people with pain, the amount of people with anxiety, the amount of people with PTSD. And these are conditions that apparently cannabis has been good for. You know what I mean? And that's because, I didn't get into it, in your body, you know, you have different systems. You have your bone system. You know, you have your immune system. You know, you have your reproductive system. You know, you have your urinary system with your kidneys and your bladder and all that kind of thing. You know, you have your nervous system. You know, you have your heart and your circulatory system. You know, you have your lungs. But we used to think there were 11 systems. And then in 1995, yes, I'm not talking about 1885, you know. I'm not talking about way back in the Romans, you know. I'm talking about 1995. I'm talking about 30 years ago. I'm lying, not 30 years. 29 years ago. They discovered a new system in our body called the endocannabinoid system. That in your body, there are these little chemicals that are produced that interact with receptors in your brain, your skin, your liver, your this, that, and the other. And it helps to control your mood, helps to control your sleep. It helps to control your appetite. It helps to control your pain level. That's why some persons, you give them an injection and they said, you finished giving me the injection yet? I say, I don't finish. And some other people, you give them an injection and they would bawl, you know, scream. You know what I mean? Sorry for doing that on the radio. I didn't mean to scream like that. It gives the impression that I scream like that. Come on, does it? It's not true. I'm just dramatizing the whole thing. Come on. You were laughing there thinking, you know, but guess what? the control of this, and just like a deficiency with diabetes of insulin, you can have a deficiency in your endocannabinoid system. And they found that this sometimes leads to migraines, especially that migraine type of pain, headaches. It often leads to fibromyalgia, pain in your muscles, in your back, and your this. It often leads to bowel inflammation. Your bowels can't walk, your bowels giving you bloating and cramps and so. And they found that cannabis in the plant helps to replace this deficiency and can help. So come November 1st, 2nd, and 3rd, there'll be 3 days of this festival where there's going to be an expo. There'll be tours. There'll be public education, and there'll be professionals coming from all over the globe to learn about the Vincentian experience and to be educated and retrained, and also to bring training. It's going to be an interesting thing. And certainly there'll be a cultural show on the Sunday night. Tickets are going to be available. I said I'll have the ticket places by the end of the week, but we're coming back. I didn't mention it. We're coming back. And Chris Martin, Bushman, Aisha, and Marla Nasha, they're all going to be there, along with lots of other local artists. Ladies and gentlemen, I bid you a very pleasant good evening and good night.
People's Pharmacy, for all your pharmaceutical, skin and body care needs. Located on Grenville Street in Kingstown. They open